Bonjour and welcome to this edition of In Bed with the Fitness Industry. I'm Nathalie Lacombe, your host and coach and Cupid in your career and in your business. I'm absolutely thrilled today to have someone who I've admired for a very, very long time and who I follow. And as I look into some of the things that she talks about for myself personally, which is kind of how it happens oftentimes. I tend to really gravitate to her content and the things that she's talked about. I've always admired her upfront honesty and comfort talking about some things in health and fitness that maybe not everybody is as comfortable talking about, but making it really, really easily accessible for everyone as you believe so deeply in those subject matters. Welcome, Kim Vopni. Thank you so much for joining us today.
Thank you. That was a lovely introduction. Thank you for having me.
It's my pleasure. For those of you that don't know Kim yet, she is a passionate pelvic health and fitness professional. She's known as the vagina coach. She uses fitness and lifestyle guidance to really help women prevent and overcome common, and I underline common, pelvic floor challenges like incontinence, organ prolapse, chronic back pain, painful sex, and so much more. So I will obviously put all of Kim's social handles and everything else if you want to find out more about what she does. But as we are in bed, and I love, for those of you that are watching this rather than hearing it, the decor behind Kim is actually quite adorable. So welcome. Thank you for joining us in bed. And
Yes.
let's talk about your favorite sleep well, which seems to dive us right into the subject matter because you've got pre-menopause, post-menopause sleep well. Explain.
Yeah, sleep I think there's a woman I know that and her brand is kind of sleep is a skill. And I think we don't
Huh.
necessarily think about it that way, right? And then once we're going through perimenopause and we get postmenopause, it kind of like pelvic floor stuff. We're told that, well, that's just what happens. And no, it's your hormones in flux. Oh, you're going through menopause. And we just are sort of thinking we have to suck it up and deal with it. So sleep for me, I prioritize it, and I am in bed by usually I try to be in bed by 9:30 or 10 at the very latest, but I shut off my phone and I read before I go to bed. And so I have my little routine that I do, turn
Mm,
off my screens and but I also try to get sunlight in the morning, which a lot of people are talking about now, how important that is
mhm.
to kind of set us up for sleep at night. I now wear an eye mask and I wear earplugs. I've even experimented with the whole mouth taping thing. And yeah, so one thing that helps also is for me hormone therapy. If I don't have my hormones and I have hot flashes, that definitely interrupts my sleep. And hormone therapy, bioidentical hormone therapy is very beneficial and helpful for me for sleep.
For you. Nice. And you sleep now pretty much in your birthday suit. You are not today, again, for those of us that are listening and not watching, you're not missing out that much. Kim exposed today. But you tend to sleep in the nude now.
Yeah, like I used to be the person. I was always cold. I would sometimes sleep in a fleece sweatshirt and pants,
Ah.
and and my husband was like,
Mm.
come on, like he's always slept in the nude and my kids have always slept in the nude. And it's not till I reached my menopause where I started to my body temperature was warmer. And now I go through my day with, my cozies on, whatever. And for sleep, I'm in my birthday suit.
You've joined the family.
I joined the
Hey,
family.
let's be happy about that. So listen, as the vagina coach and the title that you use and the nomenclature and the words that you use and how you explain what you do and communicate what you do, you've encountered roadblocks in getting your message and your education to the public. Tell us about some of those challenges. And if you see that now the frank discussions around pelvic health are a little bit easier today.
Yeah, initially when I started doing what I do, I was talking about pelvic health, but my handle or my brand at the time was fitness doula because I was working primarily with pregnant women and
Mm,
new moms. And so doulas, many people are familiar with what doulas
mhm.
do. They're a birth support person. And so I was taking the principles of being a doula. I trained as a doula and I combined it with being a personal trainer. And I was trying to help women optimize their bodies specific, using the principle of specificity from fitness to prepare for birth and also recover. We think about periodization in fitness, and recovery is a part of that. And we look at pregnancy and birth. Those are major physical events that we don't train for and we don't recover properly from. So that's where I was at the time. And I was integrating pelvic health, one of the first people to start talking about it. And I didn't really feel a lot of resistance initially. There just wasn't a lot of people that really totally understood what I did. But then as I started to evolve in my own life, but also in my business, and recognize that it's not just about pelvic health isn't something that we just need to focus on in pregnancy or childbirth. It is for people that have never been pregnant. It starts when we're young. It goes all the way until we are dead. And we go through different life phases. So as I was navigating this perimenopause and menopause phase, being the fitness doula, that brand didn't necessarily resonate as strongly. So I knew I needed some sort of a shift or a change. And I was speaking to a group of women entrepreneurs at the Mompreneur conference in Toronto. And my presentation was how optimizing your pelvic health can make you a better mompreneur. And I joked when I came on stage, because all the previous speakers had been some sort of a business coach, marketing strategy, hiring, that type of thing. And so I joked, oh, now you have a vagina coach for your business. And that was my little icebreaker, crack a joke. But after I said it, it was like, oh my God, that's it. I am going to use this term that is, it's an anatomical body part, but it's really uncomfortable. Nobody hush hushes it. And it sort of brought in the, the coach piece, being I do coach people, and it was a fitnessy type term. And so that started. It was probably about 7 or 8 years ago that shift happened. And then everybody who was kind of already a fan was loving it. But then social media, Instagram, Facebook, I was using an inappropriate term. My posts were taken down all the time. I wasn't getting any promotional things approved. So that was kind of the censorship that I faced a lot of for many, many years. And it was close to, I think, about 4 years for me to even be able to say vagina coach as my page on Facebook. And even now, if you go to the URL, it's still technically, even though on the page it'll say vagina coach as the image, but the URL still says vag coach. And so it's been interesting. But the last kind of year-ish, there's a lot of pelvic health people on social media. And so there's been a lot of people talking about the double standard with what's allowed and not allowed. And we are not sex workers, or it's not explicit content. This is purely educational. So the reins have definitely loosened up, and I don't get censored, knock on wood, anymore.
Thank goodness. Yes, knock on anything we can.
Yes.
Thank goodness for that. I find it's interesting. I see a lot of the same things when it comes to body positive coaches in fitness, and because they're showing a body part or they're talking about their cellulite or something like that, it also the same thing happens where they're like, it's, but obviously the algorithms don't have time to look at intentionality. I'm not saying they should or they shouldn't, but that's something that's come up. So thank you for standing strong and for being patient. And I'm so pleased that you're now surrounded by a discussion around it that makes it more, I assume, is growing the people coming to you and being able to connect and find you more easily. So I'm really happy to know about that. I know that you do a lot of education, and there could be hours on this because these are 30-minute or less podcasts. I kind of twisted your arm into choosing a couple of things that every health and fitness professional should know about pelvic health, and then where do they go to grow their knowledge, understanding, and capabilities?
I think the best place to start is that the pelvic floor is a group of muscles, and being a fitness professional, we learn about muscles. We learn about the muscle fibers. We learn about insertion origin, what movements are appropriate for that group of muscles and how to stimulate them, that type of thing. And I argue that in basic courses we're learning about becoming a fitness professional, why is the pelvic floor left out of that conversation? Arguably, it's the foundation of our core. Like, we learn about core exercise and fitness, and the pelvic floor is never mentioned as part of that. So the number one thing I would say to you, to fitness professionals listening or watching, is the pelvic floor is a group of muscles, and they benefit from movement, they benefit from loading, they benefit from periodization training, just like the other parts of our body. And arguably, when we have the pelvic floor working optimally, many people have more endurance. They can lift heavier, they can lift, they have better form, they have less back pain, they eliminate back pain actually. So I will argue that it is one of the most important places to start, because then all of the other things that we add on and do become more effective, and people get results. And so the things about, like, I want to flatten my abs, I want to reduce my back pain, pelvic floor, if we can optimize the pelvic floor and getting it working optimally,
Mm,
95% of women with low back pain have some form of pelvic floor dysfunction. So they eliminate
mm,
back pain when they optimize their pelvic floor, and their midsection flattens, because we have a co-contraction kind of recruitment strategy. When the pelvic floor contracts and lifts, our deep abdominals also draw inwards. And so when we think about belly button to the spine, or all of the core cues that we've told people, or where we're telling them just to engage your core, we actually want to use a bottom-up philosophy. When we know how to activate the pelvic floor, we get the co-contraction of the deep abdominals to engage the core, and then also being able to relax that is important as well. So
mm.
I would say that's fundamental. It's a group of muscles that we really should know about, and how they work, what are the common signs and symptoms if it's not working, and how can we use movement to improve things like incontinence or prolapse or back pain. And in terms of where you get that education, there
Yeah.
are we I formed a course with two other women. One was a pelvic floor physio, another is a personal trainer, and we formed a course. It was the first definitely the first in Canada. It may have been the first. It was definitely the first in North America. I'm not sure about the world. And now there are a few. There's a handful of courses where you can go and learn about the pelvic floor. Most of them are focused on female anatomy, because females are at more risk of pelvic floor dysfunction. It's more common, but the principles apply to both male and female anatomy. When last year teaching at CanFit Pro, there was this big tall guy who's his handle is 6 foot above, I think it is. He's like 6'5" or 4 or something. Big muscle, big tall. He came in, and we don't typically get a lot of men coming to our sessions, but he came in and we talked about the different cues for women mainly, but also here's some for men in terms of accessing the pelvic floor. And he went home and he came back and saw us in the hallway, and he said, you know what, I tried for men, a good cue for pelvic floor is to pull the turtle into the shell. And he's like, I tried the turtle cue when I did my deadlift, and I've never felt so strong, and I've never felt my glutes activate as much. So he
Ah,
became totally
brilliant.
bought in, and yeah, so that's what I would recommend.
Brilliant. I got to give props when you're telling this. It actually made me realize the first time pelvic floor health capabilities, etc., was ever brought up to me was actually in a yoga teacher training. So part of my yoga teacher training that I did, I've always struggled with balance poses, assuming it had something to do with my feet. And it was a male master trainer who mentioned pelvic floor or mula bandha in how
Mm-hmm.
it comes up a lot in yoga, thinking about that. And he's like, that's where we want to bring it to help you feel better in balance. And a lot of people struggle in balance poses and will think it comes from somewhere else.
Yes,
But the reality is being grounded doesn't just mean the things that are touching the ground.
1000%, thousand
So that's really
percent.
interesting that you bring that up. Thank you for sharing that. And again, we'll make sure that people know how to contact you so they can look into that extra education. But I love the simplicity of it's just like every other muscle, and really it should be taught
Yep,
as such. And if it's not, well, then let's start to incorporate it more and more.
yep.
It seems like one of the other things you talk about again, and we brought it up a little bit here in terms of female health, is I'm getting the feeling that as I should say as we, female fitness and health leaders, age, get towards perimenopause and menopause, we're talking about it more commonly. Not certainly nowhere near where we should talk about it. And I have a lot of people that's like, our moms never told
Mm-hmm.
us about this. How can female leaders, if like this is what it took, is for all of us to age to it or through it
Mm-hmm.
in order for it to become something a bit more common? How can we make it more mainstream? How can we help ourselves, our industry, as well as the men and women that come to our classes and our sessions and everything else, get better educated on perimenopause, menopause?
Mm-hmm. Yeah, well, thankfully, the conversation around menopause, the topic of the word menopause
Mm.
is exploding. And we have a lot of femtech companies, a lot of money being put towards
Hmm.
innovation, a lot of celebrities who are creating brands, and it's a whole movement. So menopause is a movement that's happening right now. So there is oodles and oodles of research, and indirectly, because there's a component of pelvic health labeled genitourinary syndrome of menopause,
Hmm.
where it's the symptoms that are bladder leakage, urgency, vaginal dryness, vaginal atrophy, increased risk of UTIs. It's a whole component under the umbrella of menopause. So because
Hmm.
menopause is being talked about more, pelvic health is indirectly being talked about more because of that. In terms of what we can do as fitness leaders, we many of us are, as you say, we're in it or have gone through it ourselves. And one thing that I've learned in the work that I do is if we can share our struggles openly and be transparent and make ourselves like a human, because sometimes people look at their trainer or they look at their fitness instructor or yoga teacher as like these beings that have everything, they got their shit together, right? And
Yeah.
so they're doing everything right, and I'm never going to be like them. And when we can hear that people who we follow also have struggles, it makes that person a little bit more human. But also
Mm.
then it's like we recognize that, oh, I'm not alone in this, and what did you do, and this is what I'm experiencing. Have you ever had that, or do you know anybody? And so I think talking openly about the different phases of life and also normalizing it. So in fitness classes, from a cueing perspective, if
Mm.
we use anatomical terms and if we don't hush hush about them, and
Mm.
if we don't use, I'm all about slang every once in a while, but we have to just label, like, pull the turtle into the shell is a cue for shorten the penis. um Pick up blueberries with your vagina and your anus, and just say the words. And initially it might be a little bit shocking for some people, but the more we do that, the more
Mhm.
we will normalize. If you have a hot flash, just like, I'm having a hot flash here, does anybody else have that? And just starting to talk openly about these changes, because as we know, the generations before us, we don't talk about that, and you just
Mm.
sit and suffer in silence, and that didn't go very well. So
It's interesting you bring that up, and thank you for sharing that. I love those ideas that are really practical and we can use. I find for myself, as I'm going through perimenopause, I actually find that a challenge that I have with my surrounding peers is this like, but just we will suffer through it.
yeah,
If we can do what we do in the gym, we can just bear with it and
yeah,
you'll eventually be fine. Just like we do it naturally, it almost as if like any form of HRT, whether, and it's obviously different in perimenopause than it is menopause, but any form of external support for that then becomes a like a failure. As
yeah,
if it's like, but if we're capable of doing what we're physically capable of doing, we can also do this. Are you exercising enough? Have you done some yoga? Are you eating well? And I'm like, you guys, it's not this like, well, because I was able to do it, then everybody should be
right,
able
right,
to. There's
right,
a weird thing, again, a weird extra pressure, it seems like, in
yeah,
health and fitness and wellness that we should be able to just bear it.
yeah, yeah, absolutely. And
Do you notice that?
yeah, and I know, like, that conversation around, I'm just going to do it naturally, or I'll get through it
Mm.
and eventually it's going to be better. There's That's another benefit with the conversation around menopause exploding right now, and the whole
Mm.
HRT, or hormone replacement therapy, or menopause hormone therapy as it's called, MHT, has also
Mm.
exploded. And there's so much confusion and fear around hormones,
Yeah.
and there's people who think that if I choose that path, then, as you say, I'm not doing it naturally, or I'm weak, or something must be wrong with me.
Yeah.
But once we become educated on all of the benefits of hormone therapy, and somebody presented it this way, that if my thyroid was not producing
Mm.
adequate, like, if my thyroid function was off and I didn't have adequate thyroid hormones, I would be put on medication. And it's a life-saving, right? It's not natural, but I need it because my production is hindered. We
Mm.
menopause, perimenopause, we have hormonal fluctuations, and eventually we no longer produce vital hormones from our ovaries. And so to say that it's not natural to replace or take supplemental hormones, it would be
Mm,
like saying you shouldn't take your thyroid hormone because that's not natural. Does that make sense? So
mm.
I feel like there's a lot of
Absolutely.
confusion and a lot of fear. There's a really great podcast,
Mm,
two resources I want to share.
mm,
Dr. Kelly Casperson is a urologist, and she has become a hormone expert along the way as well, because it's such a huge part of her work. And she recently did an episode titled Boomers Should Be Pissed. And it talks about
ha,
where the fear and confusion
mm,
around hormone therapy came from, dispels the myths, and provides the rationale to why it's beneficial, and why even people who don't necessarily have symptoms may actually want to choose hormone therapy for all of the other benefits of bone loss prevention, dementia prevention, cardiovascular risk
cardiovascular.
reduction,
Yep.
right? A huge one.
Yeah.
So that's one. And then the other resource I would say is there's a great book written by a medical doctor and I think she's a sociologist, Dr. Avram Blooming and Dr. Carol Tavris. Dr. Blooming is a medical doctor, an oncologist whose wife had breast cancer, whose daughter had breast
Mm,
cancer. So he brings a really unique lens to the
mm,
conversation and really dispels a lot of the myths and presents the facts of the women's health initiative that created so much fear.
mm,
Um, so I think that there's absolutely I'm just going to do it naturally. I'm just going to suffer through it. But I would argue that there's, some people say, oh, it's risky. And I'd say, I think there's arguments about it's risky to not be using hormone therapy. So
mm.
it's what's the best decision for you. And I think
Yeah.
it's not something we should just suffer through. It's something we should become educated about so we can make the best
Mm.
decisions for our body.
And not assume that other people, if we're, it's I was talking to my mom recently about it, and I'm like, I don't know how long this is going to be, and she told me that she went completed her perimenopause at 58, and I'm like, oh, like, so if it's for some people it's
We're
six
all
months, for
different.
me
Yeah.
clearly it'll be 8, 9, 10 years, if I'm anything like my mom. And so I'm like, there's no sit back and wait for a decade of the life. And so everybody's different. I think that's
Everybody's
just like
different.
anything else, something. But I mean, we like to pigeonhole, we like to stereotype, we like to say, well, this worked for me. And if there's one thing that trainers, I think educated and qualified trainers, certified trainers do really well, is it's not what's good for me is good for you. Everything's individualized. And so I would assume,
Yeah.
therefore,
Yeah.
let's
And
continue that.
exactly. And just like we take somebody, the person standing in front of us, we understand their health background, we do maybe
Mm,
movement exams, and we prescribe movement for that person. It's very individualized.
mm,
The journey through perimenopause, reaching our menopause and beyond is also all very individualized, and finding a practitioner who can help you. It's not a cookie cutter approach that this is what you need to do and then you'll be done here and then you transition to here. No, it's like we all have our own lives and influences and backgrounds and
mm,
medical histories, and that all comes into play. So it's very individualized, personalized, and what works for one person is definitely not. So just know the places where you can go and get informed and find practitioners
mm.
that can support you.
Thank you for sharing that. Your brand around pelvic health in particular, and being the vagina coach, is your brand and your education are very niche, very unique. Like you said, there's more people, but it's still not something that most people would be like that. I'm eliminating a lot of people if that's what I'm going towards. But you clearly have not been limited by that. If anything, it's helped you, connect better to the people who really need you. How do you stay away from the fear of limiting yourself by becoming a incredible expert in something that could feel niche to other people?
Yeah, that's an interesting question, because at the beginning when I first started, it was very niche that I was talking about pelvic health as it pertained to pregnancy, and then I kind of broadened a little bit and looked at postpartum recovery. And so that was initially what I worked with, the population I worked with for a long time. But then it was people coming saying, I've never been pregnant and I have this problem, or how can I
Mm,
prevent these problems, or I'm now dealing with this and I'm postmenopause. And so it sort of was like, oh my gosh, this is like everybody needs this. So then it started niche, and then it was like, we have to tell people in menopause, we have to tell pregnant people, we have to tell teenagers, we have to this, we have to tell midwives, we have to tell doctors, we have to train doulas. And it was just like all of a sudden we were trying. And when I say we, I meant I had two business partners
Mm,
initially in another company called Bellies Inc. And so we were like, oh my God, we have to tell everybody. And then it 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 became overwhelming and confusing to us as well as
mm,
people. Well, do you work with people who aren't pregnant, or is it just pregnancy, or are you in it? And so then it started to, we had to kind of tailor back down. And so where I am now, Bellies Inc.,
mm,
we no longer have Bellies Inc. We sold that. We all, went back to doing our own things. And where I'm at now is, it, while I talk about the different stages of life, the fundamentals stay the same. And I work with women who have
mm.
a vagina, who were born with a uterus, and that excludes a lot of people, yes, but that also there's a huge number of them. So I think when you niche, yes, you can exclude, but it makes it much easier to really perfect your craft, to really know your audience and what they need. And also then you become the expert, because those people
Mm,
go and tell other people, and you will never run out of people. You'll never fall short of clients or customers
yeah.
or what have you, which is a fear for a lot of people. So um, pick the one thing, pick the one population that you want to work with, and do it really, really well. And you will always have oodles of people to help.
That certainly seems to be the model that you've gone towards and grown the simplicity. Because sometimes
Mm-hmm.
also finding the right professional for you can feel overwhelming and confusing and everything else, but it's made it so simple. And I know, lots of people who would ask me about that. I'm like, your name always comes up really quickly, and it's easy to find because again, it's simple. And so simple helps you attract people. And sometimes the fear of who we're missing out of actually stops us from finding the right people. So I appreciate the example that you've said for that. We, to your point, are in an interesting time. We're talking about a lot of things more than we were before. When you are seeing what's happening in fitness and health and wellness over the coming months, what inspires you?
I was reflecting on this because for so long, um, everything with fitness seemed to be every year something harder, something more
Mm,
intense, something just like extreme would come along, and it would be like, okay, this is the one that's finally going to help
it's
us,
going to
right?
work.
That's
Yeah,
going to work.
yeah.
And so there was this trajectory of everything getting harder and faster and more intense and more extreme. And what I've seen happening now is, because all of those people have become injured and they're not they're they're just not feeling so good doing that type of exercise. There's a much bigger focus on recovery and yoga type practices, and more of the meditation and the mindfulness is coming into play. So it's interesting to see that transition. And now there isn't as much of the high intensity, you know routines or exercises or
4 days
classes
a
that are out
week.
there.
Yeah,
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 yeah.
exactly. And
Mm,
it may just be appear that way because it's now the population of people who I'm hanging around with. But
mm,
I do feel like it's, when I read fitness magazines or attend conferences, I do feel like there is a theme towards, it doesn't have to be hard all the time. It doesn't have to be extreme all the time. And that's okay periodically, but we have to make sure we make room for recovery. So
mm,
that that personally excites me also, because really hard extremes all the time is not always necessarily beneficial unless we've really optimized our pelvic floor. And a lot of people haven't paid attention to their pelvic floor, and then they're doing all these intense exercises, and they might be leaking or experiencing back pain, and then they think it's normal because, well, it's
mm,
just put a pad on. And we've seen lots of videos saying, well, that's what it takes to be the fittest woman in the world.
mm.
And no, that's not what it takes. So I like that there's a movement towards coming back in and being more reflective on what we need, being mindful, and choosing activities that are going to serve us, as opposed to thinking that's what we have to do to actually get the results.
I love that. And I'm grateful that you are an integral part of that. And then you continue to be an inspiration for literally and figuratively the balance and all of that in all of us. So thank you so much for sharing that, Kim. Thank you so much for joining us today. And I look forward to continuing to connect with you online and listening and seeing the services, ideas, and insights that you share with everyone. Thank you so much.
Thank you for having me.